Hi, and welcome back to Live Well with Dr. Mel. I'm Dr. Mel, licensed physical therapist and holistic health coach. And in this video, we're going to go over hip arthritis, tell you a little bit about what it is, where your symptoms normally are if you're having it, and then some great exercises to help manage the pain and symptoms. If you haven't yet subscribed to my channel, go ahead and click that subscribe button. You'll get access to all my upcoming videos. We post every week and short videos every day. And also you'll get some great free prizes coming up as well. So let's get started. So with hip arthritis, the top of the femur bone where you have a little ball and the end of the pelvis where there's a little curvature, the cartilage in the curvature of the acetabulum has now deteriorated. So now that ball where at the end of the femur where it intersects with the acetabulum is now rubbing on the end of the acetabulum. So the bones are now grinding bone on bone. In order to gain some separation from the femur and the acetabulum to allow for pain relief, you have to do some gentle stretching and exercises to help increase that space to provide some pain relief and help with the management of symptoms. I find a lot of people who are diagnosed with hip arthritis, they stop moving, which is the worst thing you can do. Some non-weight-bearing exercises, biking, aerobic exercise in the water, and some stretching can really help manage the symptoms. So don't not move at all. Try these and see if your symptoms can get better. So even though you're diagnosed with hip arthritis, I still encourage you to walk because the movement's important to bring blood flow and circulation to the area. But I know walking can be quite a chore. It could get a little painful when you've been walking for too long. So only walk as much as you can tolerate. Another option is sitting in the chair and using a pedal bike. You can purchase one of these pedal bikes right on Amazon. They're super cheap. I'll leave the link to this one in the description box so you can look at it and see if you want to purchase one. So you can just pedaling this nice and gently. You don't have to put much resistance. You can keep it on the lowest resistance. It's just about keeping that femur moving in the acetabulum to gain blood flow and circulation to the hip joint. And I usually recommend, you don't have to do it for very long. I'd rather you do it for less time more often than do 30 minutes and then not do it for the rest of the day. So I tell people breakfast, lunch, and dinner, 5 minutes, just to keep the blood flow, circulation to the hip. Because if you sit for too long and not move, that's when it's gonna feel the stiffness. And then when you do go to get up, it's gonna hurt really bad because the joint isn't loose and doesn't have good blood flow and circulation to the area. So it's also very important to strengthen the hip muscles surrounding the joint. So hip abduction will help strengthen the outside of the hip, also help stretch the inside of the groin. So just hold it for 3 seconds and lower it back in. And I would repeat this 10 times. The next one is hip extension. So trying to kick the leg back, but I don't want you to bend the knee whatsoever. Keep the leg nice and straight when you're doing this. Really squeeze your glute muscles. The stronger the glute is, the more stable the hip joint will be. So same thing, 3 to 5 second holds, and repeat this 10 times as well. The last one here is going to be a hamstring curl. So this time, you're going to try to bring your heel as close as you can to your butt, stretching the front of your hip flexor and strengthening the back of that hamstring. So go ahead and bend that knee, try to bring your heel as close as you can to your butt. Keep your chest lifted so you can stretch the front of that hip flexor muscle. You may feel a cramp in the back of that thigh. That's completely normal. A lot of people have weak hamstrings. We don't work the back of our hamstrings enough. So the stronger we can make that hamstring, the more you're going to open that quadricep muscle, release the tension in the front of the thigh, and help with your hip stability as well. So same thing with that one. Hold for 3 to 5 seconds, and I want you to repeat that exercise 10 times. In order to release that inner groin tension and pain you have here, you want to perform a figure 4 stretch. So go ahead and sit in a chair, cross your leg over, and you may notice if it's an arthritic hip, your knee may be pointed up. So you just want to press down, press the knee down towards the floor. And you're just going to sit here and hold it for 30 seconds. And I would perform this on both sides so you can see the difference between both sides and see where you want to get to. You'll notice once you start gaining flexibility back in this hip, you're going to be able to manage that pain in the hip much better. So I wanted to throw in a little bonus exercise for you. So your hip flexor can get really tense and guard, and that could cause more of a compact position on the hip, which can cause more of that bone rub. So in order to release this hip flexor to make some space in between the two bones so you're not getting so much pain. So place the pillow on the floor, place your knee on the pillow, just to give some comfort at the knee joint. And then you can bring your other hip foot up and lunge into it. This is going to help pull the hip into a little bit of an extension, and then you're going to get a nice stretch in the front of that hip joint. It's going to release that hip flexor muscle. You just hold it here for 30 seconds. Well, I hope you really enjoyed the content that I shared today. And if you have any questions, concerns about these exercises, please let me know how it's going. I'm happy to reply and answer any of the questions you have. Stay healthy, be well, and take care.